this Tuesday evening, evening extra from the BBC. Electroconvulsive Therapy, or ECT for short, is a procedure that involves passing electric currents through the brain to intentionally cause seizures that will in turn form part of the treatment for conditions like severe depression. But does ECT still have a place in modern medicine, and should conditions like depression continue to be medicalised in such a way? Well, this week there's going to be talks in Belfast on this issue. Part of the discussion will be from Professor John Reid, who's going to deliver a series of speeches. The question will be what place this kind of treatment has in the 21st century. Well, we're going to talk now to Lisa Morrison, who's had this treatment herself, and also Professor Reid is with us. Both have worked together around this issue. Thank you for coming in. Lisa, can we start with you? Tell us a little bit about what it is to experience ECT.
Experiencing ECT from where I'm sitting now as somebody who is relatively well is a violence I don't think I should have had to have endured. And I believe if distress, the causes so often of mental health issues, which we know from the research now are so often down to poverty, inequality, violence against women and girls, all those kind of issues end up with people severely distressed in the mental health system, over-medicated. And ECT for me is almost the tip of the iceberg of the failures in the system.
So you had been diagnosed with what exactly?
I've been diagnosed with bipolar disorder, schizoaffective disorder, schizotypal disorder, emotionally unstable personality disorder, complex post-traumatic stress and dissociative disorder, and the list goes on.
So you were recommended for this ECT. What was it described to you as hoping that it would achieve?
Well, what I know now about it...
What did they say then? They said, go for this.
It would help with suicidal thoughts and the depression.
Okay. Can you, before we get to what actually happened afterwards, can you step us through what having ECT is actually like? You go into a room, there is some kind of a machine there?
Yes, they do a number of blood tests to check that you're fit for it beforehand. Then you can't take your medication the night before because that can interfere with the seizure. You're taken into a room ready for the ECT. Then you're taken in and put on a table. You're given general anaesthetic. And then they administer ECT and you're taken to a recovery room.
Are there pads attached in some way for the... Is it?
Well, I always had bilateral, so there were pads on both sides of my head. I don't remember a lot of it.
Okay. And you're pointing to your temples there?
Yeah.
Yeah, okay.
You say you don't remember a lot of it, but do you still have is there still a lasting impact of that treatment on you, the way you've described it to us? I mean, is it something that you still think about and think that you shouldn't have received?
I do now. And on occasion I asked for it because getting an anaesthetic meant that I was taken out of the pain and distress I was in, that the system that I was in wasn't responding to. And I have now lost, amongst many years of my lives and nearly many years of my life and nearly my life, I have lost precious memories of my children, of my marriage, of my graduation. I child-minded my son for a year and don't remember anything about that. And I'm one of the lucky ones in many ways because there are people who've been significantly more impacted than that. And I think the issue for me, because this ties up 70% of people who get ECT are women, why are women more depressed? And it feels like in many ways, you know, we've got International Women's Day on Friday. I think many women end up in the mental health system because of trauma. And then this is a violence that you're not told your rights about. We're not actually told the correct information.
And Professor Reid, you're nodding there, saying, agreeing in terms of not being given the correct information?
That's correct. And we know that because we've researched it. We've looked at the information leaflets in several audits from England, Wales, Northern Ireland and Scotland, working with Lisa, in fact.
To be clear, this is available as part of our health service.
Absolutely,
still here.
yes. Most people are quite surprised at that.
Yes, and the Royal College of Psychiatrists have previously said that for some forms of mental illness, this is a very useful treatment. But what is your argument from your clinical perspective?
Well, there's three problems with ECT. First of all, it doesn't address the problems that it's given for. So as Lisa said, when people are extremely depressed, that they're depressed for a reason, and because some depressing things have happened. These are not medical events. There's no chemical imbalance there, despite what's been claimed for decades. Depression is caused by bad things happening, and electricity and convulsions do not address that. They cannot. But the other two reasons are there is no evidence that it works. After 80 years, there are no studies showing that it is better than placebo beyond the end of treatment. There's a little bit of benefit for some people in the short term. It raises mood for about a week or so for a minority of people. But for the majority, it doesn't. And for nobody is there any long-lasting benefit compared to placebo. If it was introduced today as a new treatment, it wouldn't pass any regulatory authority.
So should it be done away with, in your view, then? With that, in that vein, should it be banned as a treatment?
If we are going to have evidence-based medicine, then yes, there is no place for it, because the research shows that it doesn't work. But more importantly, or equally importantly, Lisa is not alone when she describes that memory loss. When you do surveys of patients who have had ECT, you get figures about between 40 and 60% of people talk about memory loss, not the temporary memory loss that the psychiatrists tell you you're going to get, but permanent memory loss, and that's brain damage. If you've got permanent memory loss, it's brain damage. So you've got a treatment that doesn't work in terms of being better than placebo and is causing long-lasting memory loss and brain damage in at least half of the people that receive it. It's hard to argue.
A further distressing factor for somebody going through mental ill health.
Of course, well, for anybody, whether you're going through mental health or not to be able to remember your marriage or your children's upbringing, or events like that would be enough to make somebody extremely depressed and possibly even suicidal. So it's a very grave situation we're facing here.
The National Institute for Health and Care Excellence has most recently, I think, recommended that the use of ECT for some cases of moderate or severe depression, as well as catatonia and mania. But they said that they were going to review that. That's quite a bit old, that position. Has it ever been reviewed or modified, the position of NICE?
NICE reviewed it last year and decided that it could be given under certain circumstances, and those circumstances are that the person must be suicidal, and they must have tried other treatments first and they must have failed. And we know again from our audits that's not the case for many people who get ECT. They're given it even if they're not severely depressed. And the best predictors, as Lisa alluded to, the best predictors are not levels of depression actually, but whether you're female and over 60.
And I was in and out of a local inpatient unit for 5 years and had ECT 3 times, which is 36 treatments, known history of significant trauma, and still had not had any psychological help.
It's important that you've come in. Thank you very much. It's a much greater, more complex conversation, but we are grateful that you've helped us to start it, and more broadly as well. This is not the first time we've spoken about conditions. In this case, it's depression, but trying to demedicalise conditions. Mm-hmm. There used to be a conversation about homosexuality once upon a time, and that was demedicalised, and that's currently where you're at now with this idea of depression.
Yes, depression is not a medical illness or a disease. Depression is a response to depressing things happening. And in Northern Ireland, you currently have 1 in 4 of your adults on antidepressants, which is quite alarming, I think. Even worse than England, and we're bad enough.
On that note, Professor Reid, thank you very much. Also, Lisa Morrison, thank you for coming in. We really appreciate your time.
It's 4:25 now, and there is a